Any other non-pharmacologic modifications that you talk to your patients about?
Yeah, I mean, there's a bunch of natural options that, depending on what you consider pharmacologic. I think it's a sticky wicket when you start talking about naturopathy to a certain extent, because you're just saying like, all right, well, I'm not going to give you this synthetic drug. I'm going to give you this natural drug, but I'm still handing you a drug, right? So I had a patient the other day who was like, oh no, I chew on willow bark. I'm like, yeah, that's aspirin. It's still not great for you all the time, but there's a lot of natural things that can help with digestion. I mean, most of us have heard of aperitifs and digestifs, right? Which are meant to be taken before the meal and after the meal. Now, granted, there's alcohol in them, but the concept was they were bitter. Most aperitifs and digestifs have a bitterness to them, and that bitterness increases a gastric muscle squeezing, right? Gastric movement, and so like bittering agents like that. I mean, Swedish bitters, ginger, which is natural anti-inflammatory, but also a prokinetic agent, can be used to help with that. That's why ginger ale has been associated with helping with nausea and upset stomach for those reasons. And so we talk about that type of stuff and some of the other natural options like alginates after the meal, and which is why we kind of came up with the reflux raft concept. But yeah, diet, avoiding chocolate, avoiding coffee, avoiding acidic foods if you can, decreasing. I think fat is okay. I think the 80s craze was like low fat diets, and in reality that just resulted in all of our foods having high processed sugar. So fat's not the enemy, but if you've got reflux, fat can be the enemy because fat does slow down the stomach. So healthy fats in the diet are fine, but if maybe your dinner meal shouldn't be the highest fat meal of your day, where things are going to sit there. So,
and why are coffee and chocolate a no-no?
Well, coffee, because it's acidic, and then the caffeine interferes with lower esophageal sphincter tone. And then chocolate is mildly acidic as well, and then has the caffeine in it. And so they do make low acidity coffees. Those are out there. And so that for that person who needs that cup of coffee, it's an option. And milk chocolate might be less acidic, but it's going to be, now you've got processed sugars in that as well, as opposed to your darker chocolates and that kind of thing. So there's something sneaking behind. But again, any diet that is too restrictive is not going to be able to be maintained by your patients. And so you have to empower them to make the best choice of the options they're presented with at any time through education and knowledge. And so like, if you're going to have chocolate, know what's going to happen, but these are the things. And again, a lot of this reflux is quality of life. And so I tell patients, I was like, look, I know you enjoy your cigarettes. I know you enjoy your coffee. I know you enjoy your chocolate, but you're also here because you've got this problem, and it's not going to kill you, but you have to make the choice and help guide them.